they're some of the most beautiful people. If you ever have an opportunity to be around someone that is autistic, their hearts are so pure and they're so loving. So what is autism spectrum? We actually start calling it the autism spectrum. So autism, now called autism spectrum disorder, is a neurodevelopmental disorder. ASD is a developmental disability caused by differences in your child's brain. People with ASD may behave, interact, and learn in ways that are different from other people. They may have trouble with social interactions and with interpreting and using nonverbal and verbal communication. Here are a few photos of what some autistic people look like. Some you can tell by looking at them. For example, Miss Montana, who also entered the competition for Miss USA. So what are the signs and symptoms of autism? Autism symptoms range from mild to severely disabling, and every person is different. You should consider the following signs of autism as possible indicators that your child may be at risk for the condition. If your child shows any of the following early signs of autism, get in touch with your healthcare provider. Signs include difficulties with social interactions, such as your child doesn't look at you when you call their name or respond inconsistently. Your baby doesn't smile widely or make warm, joyful expressions by the age of 6 months. Your baby doesn't engage in smiling, making sounds, and making faces with you or other people by the age of 9 months. Your baby doesn't babble by the age of 12 months. Baby doesn't use gestures such as reaching or waving by the age of 12 months. Your baby doesn't play any back and forth games like peekaboo by the age of 12 months. Your toddler doesn't say any words by the age of 16 months. Your toddler doesn't speak any meaningful two-word phrases, not including initiating or repeating, by the age of 24 months. Any loss of speech, babbling, or social skills. Some children with autism appear normal before age 1 or 2 and then suddenly regress and lose language or social skills they had previously gained. This is called the regressive type of autism. Other signs of autism also include specific behaviors called restricted or repetitive behaviors or interests. Your child often lines up toys or plays with toys the same way every time. Your child must follow certain routines or has extreme reactions to small changes in routine. Your child has obsessive or very unusual interests. Your child has significant sensory aversions, like dislike to loud noise, dislike to how certain clothes fit, or feel or very picky eating. Your child has sensory-seeking behaviors like looking out at the corner of their eye at objects, peering, sniffing, or licking objects. Signs of autism for girls versus boys. Girls can be better at responding at nonverbal cues and gaze following. Girls' obsession over more socially acceptable interests, such as TV shows, can be passive, generally struggle with social communication later in life. Boys can be inept at responding at nonverbal cues or gaze following. Boys' obsession over unusual interests, such as statistics and schedules. Boys can display more aggressive behaviors. Boys tend to struggle with social communication from an early age. Other signs: having difficulty understanding what others are feeling or thinking, extreme anxiety and trouble making friends, preferring their own, difficulty expressing their feelings, and need for consistent routine and getting anxious if it changes, avoiding eye contact, and problems with appropriate space, such as getting too close to other people. So what are the risk factors? This field of study is an active one for research. Current known risk factors for autism include birthing parent of age 35 or older, use of valproic acid or thalidomide by the birthing parent during pregnancy, premature labor and birth, complications during birth, low birth weight, having a sibling with autism, and having certain chromosomal or genetic conditions. What are some of the complications of autism? A wide range of physical and mental conditions often come along with autism. These conditions may include feeding issues, poor sleep, gastrointestinal problems, epilepsy or seizures, attention deficit hyperactivity disorder, anxiety and depression, other mental health conditions such as obsessive compulsive disorder, schizophrenia, and bipolar disorder. How is it diagnosed? There's no autism tests, such as laboratory tests, to diagnose the condition. However, healthcare providers can perform specialized screenings and evaluation. The steps in the process of getting an autism diagnosis include the following. Developmental surveillance. Your child's healthcare provider will look at your child's developmental history and behavior. Developmental screening. This includes questions and checklists to compare your child to other children of the same age. This test doesn't provide a diagnosis, but it can indicate if your child is on the typical developmental track or needs a more formal evaluation. All children should be screened for developmental delays and disabilities during their regular well-child doctor visits. And if your doctor's not doing that, you need to ask for it. So the doctor visits at 9 months, 18 months, and 24 or 30 months. Then you have formal evaluation, takes a more in-depth look at your child's development. A trained specialist, such as a child psychologist or developmental behavior pediatrician, will observe your child and give them a structured autism spectrum test. Specialists can do this type of evaluation also include, special needs doctors, neurologists, and child psychologists or psychiatrists. How is autism treated? Autism treatment includes behavioral interventions or therapies. These teach new skills to address the core deficits of autism and reduce the core symptoms. Every child with autism is unique. For this reason, your child will receive an individualized treatment plan to meet their specific needs. It's best to begin interventions as soon as possible so the benefits of therapy can continue throughout your child's life. Many people with ASD have additional medical conditions. These include, as I discussed earlier, gastrointestinal and feeding issues, seizures, and sleep disturbances. Treatment can involve behavioral therapy, medications, or both. Early intervention behavioral treatments involve your entire family and possibly a team of professionals. As your child ages and develops, they may receive a modified treatment plan to cater to their specific needs. During adolescence, children may benefit from transition services. These can promote skills of independence essential to adulthood. The focus at that point is an employment opportunity and job skill training, and many organizations are now hiring autistic youth. Can autism be prevented? You can prevent autism, but you can't prevent autism, but you can lower your risk of having a baby with the condition by taking certain steps, including live a healthy lifestyle. Make sure you see your healthcare provider regularly, eat a nutritious diet and exercise, get prenatal care, and take your provider's recommended vitamins and supplements. Take care with medications. Ask your healthcare provider which medications are safe and which you should stop taking during your pregnancy. Don't drink. No kind and no amount of alcohol is safe during pregnancy. Keep up with your vaccinations. Get all your provider's recommended vaccines, including German measles, rubella vaccines, before you get pregnant. This vaccine can prevent rubella-associated autism. What is the outlook for people with autism spectrum disorder? In many cases, the symptoms of ASD become milder as children get older. You may need to be flexible and ready to adjust treatment as needed for your child. People with ASD may go on to live typical lives, but there's often a need for continued services and support as they age. Their needs depends on the severity of their symptoms. For most, it's a lifelong condition that may require ongoing support. And these are faces of some famous people that do have autism. Is autism a disability? Yes, it is. And so is Down syndrome, which is another topic that I will discuss at another time. Healthcare providers classify autism as a disability. The Americans with Disability Act protects people with autism spectrum disorder. This means they may receive certain benefits. Employers must provide reasonable accommodations in the workplace. Schools must provide accommodations to students. Depending on the level of support you need, you may also be eligible for disability benefits, including Social Security and Medicaid. How common is it? According to the Center for Disease and Prevention, ASD affects 1 in every 44 8-year-old child. Autism in boys and children assigned male at birth is much more likely than autism in girls and children assigned female. It's more than 4 times more common in boys and children boys than girls, I'm sorry. The most recent data suggests autism in adults affects more than 5 million people in the US, or 2.21% in the population. According to the Canadian Medical Association journal, approximately 1 to 2%, or 135,000 of the Canadian population is on the autism spectrum. In Jamaica, 1 in every 68 children born with autism. That means out of 40,000 births, 600 children has autism. It's estimated 1 in 100 children around the world has autism. A few tips when you're caring for a child with autism, as it can be difficult and overwhelming. Always stay positive. Use child's names so they know you are speaking to them. Stay consistent on a schedule. Get child, adolescents, and adult into programs available. Be patient with yourself and with them. Keep languages simple and clear. Pay attention to your child's sensory sensitivities. Many may be, again, hypersensitive to light, sound, touch, taste, and smell. Use simple gestures, eye contact, and picture symbols to support what you're saying to them. Take care of yourself as well. Be a part of a support group. Know the resources available in your community and country. And for those of us that may not have to deal with people that have autism, be sensitive when you see people outside that have children or adults that are suffering from autism. Here are some support groups that are available. abysscenters.com. There's a 1-844-962-4222 number you can call. positivedevelopment.com, goldencaretherapy.com, autismspeaks.org, Ask for Autism Network, aane.org, capitalhealth.org, and National Autistic Society on communicating with your child. I want to give special acknowledgement to the Mayo Clinic, Cleveland Clinic, autismspeaks.org, National Autism Association.org, cdc.gov, canada.org, ncbi.nlm.nih.gov for the information that I was able to provide to you with today. Should you have any questions, please join us in the Zoom room immediately after the service, and I'll be happy to answer them for you. God bless and enjoy the rest of the service.